In today's fast-paced world, keeping up with the latest medical knowledge can be a challenge, especially for healthcare workers striving to provide the best care possible. Introducing the Clinical Care Platform, a proudly South African, wholly owned online subscription edutech company built for healthcare professionals. Our mission is simple: to improve patient care by increasing access to high-quality, evidence-based educational resources, anywhere, anytime. With our membership subscription, you gain unlimited access to a growing library of over 155 CPD-accredited courses, weekly micro-lessons, and 10% discount on paid e-learning courses, all curated to align with local and global guidelines. Join live webinars, over 160 sessions and counting, earn CPD points on your schedule, and download key clinical resources, including templates, research reports, and practice guidelines. Subscribe, get educated, earn CPD points. With the Clinical Care Platform, lifelong learning is just a click away.
Missed our latest webinar? No worries. We know life gets busy, but your professional development shouldn't have to wait. That's why we've created webinar micro lessons. Short, focused recaps of our full sessions designed to help you catch up quickly and still earn your CPD points. These bite-sized lessons are available exclusively to active subscribe members. So even if you miss a live session, you never miss out on the knowledge or the CPD points. Not subscribed yet? Now's the perfect time to join. Get access to all future webinars, every micro lesson and more. Visit www.clinicalcareplatform.com to sign up today.
For the Diploma in Obstetrics, Internal Medicine, Child Health, HIV, Anesthetics, or Ophthalmology. Our programs are designed by experienced doctors who understand what it takes to pass the CMSA exams. Diploma in Obstetrics, with expert guidance from a qualified OBGYN. Our obstetrics program offers a structured approach to written papers, OSPES, and OSCEs, with practical obstetric skills, small group learning, and real clinical case studies to sharpen your decision making. Diploma in Internal Medicine, designed for medical officers preparing for the CMSA diploma or aiming to upskill. This program includes weekly live coaching, CPD accredited masterclasses in ECG, X-rays, and lab interpretation, access to 15+ accredited courses, and a comprehensive resource library. You'll also get a letter of recommendation and a practice exam. Diploma in Child Health. In a country where pediatric care is critical, the DCH Prep program equips you with accredited competence across neonatology, infectious diseases, nutrition, emergency medicine, and more. It's designed to bridge the gap between med school and specialist pediatric practice. Diploma in HIV Management. For doctors working in primary care, CHCs, or district hospitals, our HIV diploma program offers expert-led preparation across all 27 professional activities with case-based MCQS, data interpretation, and ongoing clinical updates, all within a supportive peer community. And we're excited to introduce 2 new additions to our diploma preparation family. Developed in response to your needs and aligned to the latest CMSA requirements, Diploma in Anesthetics. After years of fragmented prep, our intensive 12-week anesthetics program brings structure and support. With 72 contact hours, 2 expert-led sessions per week, and content aligned to 25 CMSA core topics, you'll be learning from senior DASA diplomates committed to safe, quality anesthesia care. Diploma in Ophthalmology. General practitioners can now better manage eye conditions through our ophthalmology prep program, covering clinical diagnosis, emergency management, pediatric and adult conditions, and practical OC preparation, all aligned to CMSA standards. This is more than just exam prep. It's professional development with purpose. Registrations are still open. Visit clinicalcareplatform.com and take the next step in your career today.
Oh, all right. Good evening, colleagues. You got me off guard there. I was trying to prepare. I feel a bit chilly. Yes, how are we doing? And welcome to the Clinical Care Platform. This is our first webinar with just our members. How awesome can this be? I am so excited about this decision by the team, and I hope that going forward we are able to offer you, the customized service that you deserve as our members. I am so super excited. You are too many. I wanted to count you one by one, but Abdul, Adedabola there, Ahlam, Andre, Andrea, Anele, Dr. Da Silva. Dr. Da Silva, I was in MLO today. I was teaching on HIV, and it reminded me of the old days. I was in a clinical forum. Just remember where we connected. So I'm so happy to see you, Aisha, Bafana, Brian, Doki. So colleagues, I can't I can't say, just type hi there in the chat at least, so that Badla, welcome, Marcel, Martin, Suler, you, Maria Rivera. Yeah, it's awesome. It's awesome, colleagues. Dr. Pule, yes, I was. Oh, you jumped to KZN. I was about to say I was with your Abajuba people, but I remembered that you jumped to KZN. You must come back, colleague Dr. Ilunga there, Dr. Nelson. Yeah, it's such an awesome colleagues to host you as always on this platform. I always go out to recruit. So today as well, I am not alone. I'm never alone. I am with Miss Musidi Shumang. Hi, Musidi. Welcome, ma'am. Are you well? Are you good? You can just say hi.
Hi, Doctor, and hi to everyone. Good evening. I am well, thank you.
Thank you. You are welcome. You are welcome. Colleagues, just to remind you that this is our platform. We continue to be a membership-based platform. Some of you paid to join today's webinar. Do visit our website, check it out, because we have a huge mission, which is to improve patient care. And we want to do this by bringing you, evidence-based education. And we are clinicians. Yes, we love the clinical world. But as you can see today, we are bringing another world, which is very, very important. As a great a clinician as you are, if you don't appreciate risk, if you don't appreciate how to manage yourself, to manage your business or, your estate, there's many things that can go wrong. So I'm so excited to bring you today's webinar, which is accredited for at least 2 ethics points. And I want to introduce, we go straight to the webinar. It's diploma season. So we don't want to say, a lot of things. So yeah, so I present to you Miss Musidi Shumang. She's the managing director of the Schumann Group of Companies, which provides advice on risk, insurance, reinsurance solutions. She holds a master's in business leadership, a degree as well. You can see there, Bachelor of Admin at an honors level, but also at a degree level, both acquired at the University of South Africa. She's a member of the Institute of Risk Management South Africa, the Institute of Directors. Yes, I went through that directors program, by the way, at some point, Bebuzini. So I think we must come back and talk about governance and those kinds of things. She's also a fellow member of the Insurance Institute of South Africa. She provides consumer education. Me and you, in this instance, we are consumers, on behalf of the South African Insurance Association, which is an association for non-life insurance companies, mainly on radio and webinars. And we are happy to host you, and we look forward to more and more. She provides technical expertise and content on topical insurance issues which affects the industry. In this instance, it will be around healthcare. Her career includes being a chief claims officer for Zurich, Southern Africa, head of claims and assessment at Santam, head of bond cancellations at FNB, and the executive for shared services at Transnet Housing. So she has consulted in the South African Special Risk Insurance Association on large and complex claims. She has serviced on the following boards: the Mauritian Eagle International Association, Auto, Theft Investigators, Lifeline, Ekurhuleni, Boharo Trust. This is just a little that she has managed to achieve, colleagues, up to now. I'm so excited to host her. We have had a number of meetings, and I think we also have future plans, to bring you more and more in these valuable topics. Memusidi, can I hand over to you? You may maybe switch on your video. I'm sure colleagues would love to see you as you share your slides and say hi to them. Thank you. Colleagues, let's give her lots of love. You know how we welcome our guests here at home. Lots of love. Thank you.
Thank you. Thank you very much. I just want to check if I am audible to.
Yes, you are loud and clear. Thank you.
I'm loud and clear.
Yes.
Okay, thank you so much, Doctor. And thank you to all the doctors who have joined. It's always a pleasure for me and a privilege to present to the health professionals. And I'll be talking about a topic that I myself dearly, value and see it as an important topic. So issues of risk and using insurance as a tool to mitigate the risk. So I'll be sharing my slide with you. You will tell me once, I'll check if it's on, and you can.
Awesome. Yeah, you can go through. Just to say, we have a variety of health workers, from pharmacists, mostly it's doctors, but we have nurses, physios, audio and speech, dietitian. Colleagues, if I didn't mention you, it's not, I can go on clinical associate. So I'm not choosing, I'm just saying we have a variety as well. Yeah. Thank you, ma'am.
Okay. No, thanks for the clarity. The topic today is about mitigating risk exposure within the health profession. So the idea is the focus would be when you run your practice, whether it's a clinic, whether it's a small practice that you're running, in general, there are risks that you attract as a practitioner or as a health practitioner. And I'll be talking to a few of them that we're seeing in the industry. We can expand later on others, but I believe today these are some of the risks that I would like to share with you. Now, for those who have private practices, I just like to run a quick quiz to say, when you engage service providers, either an accountant or you bring in locums to look after your practice, think about it. Do you run a due diligence? Do you verify their credentials? Do you know whether what they're performing is correct? Do you have a recovery plan in case you have a cyber attack? These are some of the questions I would like you to think about. You don't have to answer them. And do you have a plan in case there's bad publicity, maybe that came due to malpractice? You're being accused of treating a patient badly, and in most cases, it tends to come with bad publicity. With the social media days now, things fly very quickly. So what is your plan if something like that happens? Do you have a practice or a family complaints process? It is a regulatory requirement, but what is important about it, it serves as an early warning system. So these are some of the questions as I will be talking to you that I would like you to apply your mind to it and ask yourself, yes, you do, maybe you don't. One can ask, why risk management? Why do you have to mitigate your risk? And we talk about this topic because we realize we've worked hard. Firstly, we've studied quite hard. We work hard to build whatever we have, even in your private capacity, whether it's your house, it's your car, is the investments you have. Those things you would want to preserve them so that it's a wealth that you can pass on to the next generations, and you wouldn't want it to be disrupted or destroyed by a single event. So as practitioners, we would like to see us managing the risk. Events do happen, but they don't have to destroy us or take us out of the game. And that's why we talk about risk management. Now, in general, when we look at our businesses, most of us look at what we call big ticket items. So any system is made out of the big parts and the small parts, but we tend to focus on revenue generation, investment, seeing patients performing